Hi folks, Dr. Ed Beyer here at Beyer Natural Health Solutions. Today I'm making this video to go over the most common cause of female hormone imbalance that I see clinically over the last 33 years all the time on a daily basis in my office. The purpose of this video is to shed some light on the true underlying causes of why so many of you are suffering with female hormone imbalances, and also to really let you know that once we identify what these underlying causes are, we really can correct them through functional medicine. Whereas traditional medicine is pharmaceutically driven, what we see typically there is if you're menstruating, they're going to put you on the birth control pill or put you on synthetic hormones. So we're going to really address the underlying causes so you have a better understanding of and better hope of what can be done. So we all know the symptoms of female hormone imbalance, right? You're gaining weight, you're tired, you're depressed, you have food cravings, you have hot flashes, you have heavy periods, you have light periods, they're irregular, a lot of pelvic pain, headaches, migraine headaches, anxiety, insomnia, and long-term results are osteoporosis and even cancer. So these are symptoms that I see on a daily basis, and if you're suffering and you're going the traditional medical route, please pay attention to this video because you're going to really learn and it's going to give you a greater hope. So the key point is that hormone imbalances don't just happen by themselves. There's underlying causes to them that traditional medicine doesn't look at. It's very frustrating to me and obviously to you. So to really keep it simple, for hormones to work properly, you have to there's four things that have to happen. You have to be able to produce the hormone. Then the ratio, especially between progesterone and estrogen, have to be right. For hormones to work, they have to attach to a receptor site on the cell in order to have the effect on the cell. And a lot of you, that's not happening. And then, very important, once the hormones are made, once they attach and they do their job, they got to be removed either through feces, urine, sweat, or breath. So the big underlying causes to an imbalance, especially between progesterone and estrogen. Number one, adrenal gland dysfunction. When the adrenal glands, even when you're menstruating, about a third of your hormones, of your progesterone and estrogen, are coming from your adrenal glands. And that goes up to about 50–60% when you're in menopause. So the adrenal glands, which are the stress glands, really, really control how many hormones you're going to be able to make and the balance of it. The second thing that a lot of you have is unstable blood sugar. If your blood sugar is going too high, or in a lot of cases too low, what happens is you're going to get insulin surges, because insulin is the hormone that pushes your blood sugar, your glucose, into the cells. Nothing more will disrupt progesterone and estrogen ratios more than insulin surges, so we have to look at blood sugar. The third reason is inflammation. And that inflammation, what I mean is not inflammation where you hit your thumb with a hammer inflammation. I mean like whole body, systemic, and brain inflammation. And the sources of the inflammation can be so many different things. Common ones that I see are autoimmune disease, especially in the thyroid, food sensitivities, eating poor fats will stop the hormone from actually attaching to the receptor site. That's a huge one. And making sure that you get proper essential fatty acids in the body. So vegetable oils and trans fats absolutely will disrupt your hormones quicker than anything. Another source of inflammation are hidden infections like in the gut or certain viruses, and even Lyme disease I see a lot of. Another condition known as Leaky Gut Syndrome is the gateway to inflammation. And what inflammation does, I want to teach you this is very important. Inflammation shuts down your ability to use your hormones in two ways. The area of the brain that controls your hormones, the air traffic control tower of your hormone, the neuroendocrine portion of your brain is your hypothalamus and pituitary gland. Those two areas of the brain tell your endocrine glands, your ovaries, your adrenal glands, your thyroid, when to produce hormone. That area of the brain is super sensitive to inflammation. So when you're inflamed, the chemicals of inflammation, which are called cytokines, attack that area of the brain, and that area stops sending signals to regulate your hormones. The second way that inflammation stops your hormones from working is they actually they prevent the attachment of the hormone to the receptor site. In order for a hormone to work, it's got to attach to a receptor site, like a key into a lock on the cells. When you are inflamed, that's not going to happen. So before we even consider putting you on bioidentical hormones or on birth control, which really does a lot of bad things, you got to take care of these issues. Other sources of inflammation are disruption in the gut microbiome, anemias, gut function, liver dysfunction, thyroid dysfunction. All these things can create imbalances in your hormones, and that can be corrected. The fourth one is proper elimination. If the gut is not working properly, if your liver is not detoxing, if your kidneys aren't working, then you're not going to be able to eliminate hormones from your body. Remember, hormones need to be made, they need to be in balance, they got to attach to a receptor site, and they got to go. So what we need to do to really sleuth out and understand the individual patient, because everybody's different, is we got to do very comprehensive blood work, which we do, very extensive, looking at all the markers. For example, just with thyroid, we run 9 markers, not to 1 or 2. We got to check for food sensitivities, because that's a major source of inflammation. We do a blood test looking at what foods are you eating that's causing chronic inflammation. We do a DNA stool analysis to look at the gut microbiome. And then we do a leaky gut testing, because if your things are leaking into your bloodstream that don't belong in your body, that's going to create systemic inflammation. It's going to shut down the neuroendocrine axis, and it's also going to prevent your hormones from attaching to receptor sites. And then we do a very good adrenal hormone test. Now, here's the question. Have you had any of these tests? Your doctor is not going to run these. Listen, if you like what you're hearing right now, just hit the like button, and then you'll be exposed to more of my videos if you like what you're hearing. Now, have you been told that the little bit of testing they do, have you been told that it's normal? Let me teach you a little bit about lab ranges. So when you go to a lab and you get a test, the doctor is going to compare you to lab ranges, right? Well, here's how they determine what a lab range is. A lab range is based on the average low and the average high of whoever's been in that lab for the last year. Well, what kind of people go to labs? Are they usually healthy or are they sick? They're usually unhealthy. So the lab ranges that your doctor is comparing you to are lab ranges based on an unhealthy population. We don't do that. We compare you to functional ranges the American Academy of Chemists and the Endocrine Society have determined. And so that's the reason why so many of you are going and getting lab tests, and they're not in depth enough, but you're getting the results and your doctor's saying you're normal even though you're not, when we compare you to functional, healthy people ranges. So right off the bat, 50% of female hormone imbalances can be fixed just by addressing the adrenal glands. So the adrenal glands, like I said, are responsible for 1/3 of reproductive hormone production in premenopausal women, and in postmenopausal that goes up to 50–60%. And there's a lot of things that can stress the adrenal glands, like anemias, blood sugar issues, inflammation, poor sleep, stress, nutritional deficiency. So we have to address all those to make sure that the adrenal glands are working. So progesterone levels is the hormone that's really mostly affected when we look at these ratios between progesterone and estrogen. So with adrenal exhaustion, what's going to happen when the stress glands start to fatigue, the state of estrogen is kind of the same, but progesterone goes down. So there's a very important ratio between progesterone and estrogen that's very important for good hormone health. In the luteal phase, the second phase of a female cycle, progesterone should be about 25 times higher than estrogen. Rarely do I see that. When these ratios go off, when they're below that, we're going to see all kinds of symptoms of progesterone deficiency or estrogen dominance. It's important to remember that you can have estrogen dominance without even having estrogen high. It's the ratio. So if progesterone goes down and estrogen stays the same, that's estrogen dominance, even though estrogen could be in the proper amount. It's the ratio that's important. So very common symptoms of progesterone deficiency or estrogen dominance are anxiety, depression, weight gain, irregular menses, either short or long, hair loss, cramping, acne, low sex drive, mood swings, depression, excessive bleeding when you have your period, activation of endometriosis. The excessive bleeding can cause an anemia, which I commonly see iron anemias when females have heavy bleeding due to progesterone deficiency. So the adrenal glands is a major source of progesterone in addition to the ovaries, so we have to look at the status of the adrenal glands. So some symptom of estrogen excess may be similar to low progesterone, but there's some difference. When estrogen is actually too high, Estrogen's like a growth hormone. Estrogen is a hormone that's responsible for breast development and the external genitalia and the ovaries. So we'll see extra growth like cancers, right? So most cancers, breast cancers, are estrogen dominant. You don't want to have that ratio below 25:1 because that can lead to estrogen-fed cancers. So we'll see, in addition to cancers, which 1 out of 8 females have, breast swelling and tenderness, fibrocystic breast, water retention, uterine fibroids, cystic ovaries, anxiety, heavy irregular menses, low libido, fatigue, weight gain, mood swings. This affects the thyroid, so it can cause low thyroid, elevated cholesterol. All these different things happen when there's not enough progesterone to balance the estrogen. So the solution to estrogen dominance or progesterone deficiency, number one, fix the adrenal glands. First and foremost, you gotta fix the adrenal glands because that's a major source of your progesterone. Sometimes we need to do bioidentical progesterone, usually in the luteal phase of the cycle, but rarely do I have to do that in younger females. Once we address the production, the inflammation, adrenal issues, and elimination of hormones, rare is the day that we need to put you on bioidentical progesterone. The other thing is the traditional medical response to this, when you have all these issues, just put you on the pill, right? When you go on the pill, you become estrogen dominant, ladies. You need to realize 1 out of 8 females gets cancer, breast cancer. When you go on the pill, that goes down to 1 out of 5. Because even though it may help you with your symptoms, it's producing estrogen dominance in the system. And a female is meant to ovulate. There are over 100 different biochemical processes in the body that are dependent on ovulation. Ovulation is not just about conception. Ovulation controls a lot of chemistry in the female body. We are able to get females off contraception, birth control, very easily once we address inflammation, adrenal issues, and elimination. So with estrogen dominance, we got to clear out excess estrogens. Estrogens have the longest half-life in the female body and in the male body too. They're the hardest to get rid of. So if there's any liver dysfunction, if your gallbladder's not working, if your gut's not working, or you have kidney problems, the estrogen builds up in the bloodstream and you become estrogen dominant. Then there's this whole thing called xenoestrogens, which are estrogen-like substances in our foods and our plastics. We educate the patient on how to avoid those. So we have to address the underlying metabolic problems in order to get the progesterone, estradiol, and estrogen, which is the strongest estrogen ratios, back to 25:1. Pretty easy to do in most people. So progesterone, the other thing, in the perimenopausal female, progesterone gradually declines beginning at age 30. So the average age of menopause is 51. So by the time you hit menopause, your progesterone levels are a lot less than they were at age 30. But estrogen doesn't do that. So we got after 30, we got progesterone declining and estrogen stays the same. So that is just a built-in mechanism for estrogen dominance or low progesterone, which causes all those symptoms that we just mentioned. In managing and underlying causes of female hormonal imbalance, I'm going to repeat, we have to fix adrenal dysfunction. We have to correct any blood sugar or insulin surges. We have to control inflammation, whatever the source is, and we have to have proper elimination. When you do those 4 things, we can get you off the pill. And without having the symptoms, we can put in remission endometriosis, all these different issues that I see, all the symptoms, the neurological symptoms that occur with female hormone imbalances. Traditional medicine does not do that. Functional medicine, we look for these underlying causes. So also in menopause, now the ovaries are no longer producing, right? They've gone on a permanent vacation somewhere in the Bahamas or Caribbean, and now you're really dependent on your adrenal gland health is crucial when you're in menopause. So women who have really, and they're not that many, really good adrenal health, they sail right through menopause. They don't even know that it hit them. And again, the average age is 51, and the definition of menopause is no periods for a year. But adrenal health is paramount, and controlling inflammation and elimination of hormones, blood sugar, and production of hormones through the pituitary and hypothalamus. Proper estrogen-progesterone ratio balance has a huge impact also on brain neurotransmitters. Serotonin, which is the neurotransmitter that makes you feel fulfilled, gives you problem solving, makes you look at the glass like it's half empty, that's half full, not empty. So it's the happy hormone. It allows us to sleep. That neurotransmitter is dependent more on estrogen. So low estrogen, serotonin gets screwed up. We get depressed, we don't sleep, we get hot flashes and all that. Dopamine is another neurotransmitter that's dependent upon progesterone. And dopamine has a lot to do with focus and motivation and pleasure. So with low progesterone, we see lack of pleasure, low libido, not enjoying things you used to enjoy. We see lack of motivation, you can't focus, things like that. Acetylcholine is another neurotransmitter that's dependent on both of them. Estrogen and progesterone, that's all about memory. And then GABA aminobutyric acid, is the calming neurotransmitter. Man, I see this all the time clinically. When you have low progesterone, which is so common, especially if you're on the pill, the GABA, the calming neurotransmitter, does not work without progesterone, and you're just ramped up. You're anxious, you don't sleep, all these very common things that I see. So again, I'm going to repeat. 4 steps to correcting hormones. You got to look at the production. You got to look at the ratios. You got to look at the ability to bind to the receptor site, and you got to get rid of them. And in order for that to happen, you have to have good adrenal health. You have to make sure that you're not chronically inflamed, and you have to have good, stable blood sugar, and you got to control all sources of inflammation. I'm Dr. Ed Beyer. If you like this video and you want to see more videos, please subscribe, like, and share this with friends and family. Have a great day.